my husband has a cyst on his back that needs to be removed. What are the chances of it coming back? Yeah, well, the different ways of treating a cyst are sometimes people kind of like lance them, so sort of like just kind of like get the stuff out of it and empty them, and that kind of looks like it's got rid of them. The problem is the cyst wall remains, and if the cyst wall remains, they do come back. So I would say the best way to treat them would be to remove that cyst with the wall. Um, um, and if you remove all of the cyst with the cyst wall, then it won't come back. The problem is that there's the if. So there is a chance that when we remove it surgically, that we leave some of the cyst wall behind, and if that happens, it can come back again. So it has got a much lower risk of coming back if you have it removed surgically and have the cyst wall removed completely than if you just have it kind of lanced or something like that. So no one can ever give you 100% really success with any operation, really, to be honest with you, unfortunately. But in general terms, if it's kind of like a fresh cyst that's never had any infection, that's never been operated on before, there's a good chance. Doesn't sound good, does it? I can't give you figures, but there's a good chance it won't come back because it depends on how it goes during the operation. But if it's a nice clean cyst wall that comes out cleanly, and sometimes it does, then it should not come back again. And that there's reassurance on that one. But sometimes if it is not clean, if it is not easy, if it's a bit scarred, if it's a bit stuck, it's a bit difficult to get that plane between the cyst and the sort of surrounding skin, then there is an issue that you could potentially leave some cyst wall behind. And some people do try and remove cysts through very small incisions. I usually use an incision about the same diameter as the cyst, but you see people who are trying to remove it through very small incisions, and through a very small incision, you can kind of puncture the cyst to get the contents out, and then when the contents are out, you can just try and tease out the cyst wall, which is great because it's a smaller incision, but it's even more difficult to ensure that you've got all of the cyst wall out, and so the chance of recurrence are higher. So it's always a balance about how you have it done. That's why it's always good to have a chat with the doctor or what have you, but to sort of balance up what the best way to remove it for you would be. Personally, I don't do that small incision and puncturing the wall and taking the sac out separately. I try and get the cyst out complete. Sometimes it does. Sometimes you do breach the cyst wall, but and if you do breach the cyst wall, then you try and kind of keep hold of it to make sure you get the whole of the cyst wall out. So it's always the idea, but you can never 100% guarantee it. So it shouldn't come back. Personally, I always say, look, if it does come back, I'll do it again. In fact, I think I'll do one this week that came back, but I think it was already a current one when I saw her first time. But anyway, nevertheless, it's not that common just because I'm happening to be doing one this week, or maybe it's next week. But yeah, so if it does come back, we wouldn't charge you, but the aim is to get it out and with the cyst with the wall completely, so it doesn't come back again.